Hello, my name is Robert Westerville. I'm here to present a business plan for Azusa Regional Medical Center Outpatient Womb Clinic. The outpatient womb clinic industry is a vital segment of the healthcare system focusing on treatment and management of various types of wombs, particularly those that are chronic and associated with specific medical conditions such as diabetes. As we prepare to launch Azusa Regional Medical Center in San Diego, California, we recognize the growing demand for specialized womb care services. Over 30 million people in the United States have diabetes, and a significant percentage of these individuals will experience foot diabetic ulcers at some point in their lives. This underscores the critical need for effective womb management solution tailored to the unique situations faced by these patients. In addition to diabetics, the aging population is a significant factor contributing to the growth of the outpatient womb care market. Our services here will be designed to meet these needs with a focus on comprehensive womb management programs, advanced assessment services, and customized solutions that cater to individual patient requirements. Our focus lies in addressing the specific needs of diabetic patients. Our goal is to create a compassionate and healing environment for our patients, ensuring they receive the highest standard of care. We offer a range of specialized services, including diabetic wound management, advanced wound assessment services, customized dressing solutions, pressure ulcer preventive programs, and womb education workshops. Our goal is to empower patients with knowledge and provide them with personalized treatment plans that cater to their unique circumstances. So our target audience is basically diabetic patients. This segment requires specialized care to manage wombs effectively due to their diabetes. They seek comprehensive management programs that address their unique health challenges. Typically range between 40 to 65, middle to upper class, residing in the suburbs. Their purchasing behavior, they're willing to invest in healthcare services that promise better solutions. They often research online for the best facilities. Another targeted audience is chronic wound patients. This group requires constant and ongoing treatment for wounds, often needing specialized products and educational resources to manage their conditions. Typically older adults over 65, low to medium income. Their purchasing behavior tend to be limited financial resources, making them more price sensitive. They often depend on referrals from general practitioners. And the last group we're going to focus on is caregivers of womb patients. They seek educational resources and support to help manage the wombs of their loved ones. They need guidance on the best practices and products that ensure effective care. Age ranges from 30 to 55, often female. The income can vary. They're usually family members or friends of the patients. So on our SWOT analysis, the strengths, we'll offer specialized womb care services tailored specifically to type 2 diabetes patients. This specialization allows us to address specific needs to this population, which ensures better outcomes and satisfaction. Personalized treatment plans will offer comprehensive care with a diverse range of services for diabetic foot ulcer treatment to preventive care. This allows us to address various needs or concerns within this population. Another strength is ED open beds. We'll have a dedicated unit for womb care. Prior patients were admitted to available beds in the ED. Wait times will be reduced since this population has a dedicated location for care. In addition, patients' stay wait time will decrease since they can receive similar care in the outpatient setting. Cost effectiveness, patients won't require inpatient hospitalization, but instead can receive the same care for less cost with outpatient treatment. And continuous staff education, that's something we're going to prioritize to get our team ready to give the best treatment and care for these patients. So the weaknesses, we're kind of limited to type 2 diabetes patients. Other patient populations can benefit from our womb care, but we're kind of focusing on diabetic patients. Limited scope. Treatment is limited to womb care rather than other aspects of the diabetic patient population. we're kind of limited just to the skin. Lack of insurance coverage. Medi-Cal will cover ED visits, but sometimes outpatient treatment coverage may be limiting. So we have to keep an eye on that. And we have a very small employee base with only 2 employees, nurses. It's very small, so that can form a type of weakness too. Opportunities, expansion. There's always room for expansion. We can have like specialized services, or we want growth. One area is mobile services, possibly expanding operations by offering the services at their residential care. There's a growing demand for outpatient services. The increasing preference for outpatient care presents us with the opportunity to capture a larger market as patients seek like convenient, specialized services for their womb care. We really want to partner with local healthcare providers because collaborating with local healthcare providers and diabetic support groups can enhance our visibility and credibility and gives us an opportunity to have more patients. Healthcare incentives, there's a rising trend in health education, particularly regarding chronic conditions. By offering these healthcare workshops, education workshops, we can position ourselves as a community resource. And technological advancements, embracing new technologies in womb care can enhance our treatments and operations effectively. All right, the threats. Intense competition. We face competition from larger healthcare facilities that might have more extensive marketing budgets and resources. However, by focusing on our strengths and unique offerings, we can carve out a niche in this market and emphasize personalized care. Economic downturn and poverty could affect patients' ability to afford healthcare. In order to address this, we can offer flexible payment plans and work with insurance companies to help all income levels. Again, we're a small staff, 2 womb care nurses. If there's a call out, we are at a shortage. We may need to expand our staffing to meet the needs of our growing population. And regulatory changes, changes in healthcare regulations can pose challenges. We need to stay informed on the developments and ensure compliance. So implementation, year 1. So month 0, exploration and planning, assemble the core team, define the roles, identify the chain of command, clearly outline the clinic goals and objectives, and secure funding and resources. Month 1, develop training and materials, create a training plan and materials for all relevant staff and users. These resources should align with our clinic goals, set up the facility and stock supplies, and we need to begin on-site training for employees. Months 2 and 4 through 4 is kind of we're going to launch a pilot, open a clinic to a selected pilot group. This allows us to work out any issues in a controlled environment and continue training and training sessions. And we can monitor and collect feedback from our participants and like kind of troubleshoot and refine what we're doing. Months 5 through 12 will be full implementation. We're going to scale up the program, open clinic to intended user base while applying lessons learned from the pilots. We're going to conduct comprehensive training to train a wider group of employees, ensuring they have the necessary skills and support. And next one, our 10-year plan. So years 0 to 1, we want to establish a patient intake process that successfully enrolls at least 100 patients within the first year. And we want to have a target marketing campaign to increase community awareness, aiming to reach 5,000 potential patients. We want to conduct a minimum of 10 womb education workshops within the first 18 months to enhance community understanding of womb care. And we want to achieve patient satisfaction of at least 85% the first year. Years 1 through 5, we want to expand our services to include 2 additional womb care programs within the next 4 years. We want to increase our enrollment to 300 patients within the next 3 years by enhancing our marketing strategies and community outreach efforts. We want to develop partnerships with at least 3 local healthcare providers to create like a network within the 4 years. And we want to achieve a 20% increase in patient retention rate within the next 5 years. by implementing like comprehensive follow-up care and personalized treatment adjustments. Long-term plans, we want to be a leader in San Diego. We want to expand our locations within the next 7 years, increase patient capacity by 50%. We want to have a telehealth platform so we can just reach out and expand our services within the next 6 years. And we want to achieve a sustainable annual growth of 20% over the next 10 years so we can position ourselves for a long-term financial stability and community impact. Evaluation plans is RN satisfaction surveys. When patients leave, they fill a survey, and we really want to have a good score on that. Another thing we can measure on is patients' falls. Since many rooms were designed for diabetic patients, they're a higher risk for falls, and we want to kind of watch that out. Finally, financial outcomes, the number of patients per day, it's going to be between 12 to 15. We expect that to increase. And staff turnover is a sad part in our industry. We want to maintain our staff, have a culture that we help each other and be there for each other. So for costs, so approximately 20% of the country's on Medi-Cal. So we calculated 13 patients per day. At least 2 of them are going to be on Medi-Cal. And based on our calculations, the revenue will be 1.5 million about. About 38% of Californians are enrolled in Medi-Cal. Now, it's California's free insurance. They will cover 100% of the costs, whereas Medicare only covers 80%. Annual revenue would be about 3.7 million. And for private insurance, we calculate about 6 out of 13 patients will have private insurance. Annual revenue would be about $5.6 million. Operating costs, so we're going to have salaries, nurse practitioners, and RNs. We have to meet their salary needs, as well as medical technicians. I'm recommending 2, because we always need at least 1. If one calls out, we have 1 there. If they're both there, it's better service. Benefits, the annual cost calculation for family coverage for all employees. So if they're single, it'll be less, but the most it might be is $785,000 for our small employee base. Of course, we're going to have Medi-Cal and Social Security tax, about $31,000. Office supplies, medical supplies, annual costs about $73,000. And then we're going to need assistance like outside services. We're going to need an MD because a nurse practitioner has to work underneath one. In addition, we're going to need a receptionist, and each of those has costs to $300,000 for MD and about a little under $50,000 to have a receptionist. So we need a one-time cost for an Intellect multimodal machine, about a little $4,500, and IT will have a monthly cost of $1,500 per month, would be about $18,000 per year. So our marketing plan, we expect about 8 to 12% of our annual revenue will be dedicated to marketing, which would be about 1.4 million per year if we see 13 patients per day. At least 50% of this budget will go toward digital marketing, because we learned that 72% of the US internet users have searched for health information online. Of course, we're going to need graphic and printed materials because 95% of specialists use these handouts, and it helps with referrals. And we obviously want a social media presence, Facebook, Twitter, as well as good patient reviews. So that's my presentation. I think this outpatient clinic will be very beneficial for a community. I think it has an opportunity for growth and enables us to be a leader within this medical niche currently, as well as long term in the future. Thank you for your time, and I hope you consider it. Thank you.